First and foremost, I'd like to note that conscience protections already exist in current federal and state law. Others behind me will testify more in depth on those laws. Title VII of the Civil Rights Act of 1964 has existed in federal statute for over 50 years. It's been tested and resolved through extensive case law and works in the real world. Healthcare providers are already required to have accommodation policies for practitioners with conscious objections and to make reasonable accommodations for providers with those conscientious objections. The South Dakota civil rights laws also protect an employee's religious beliefs and conscience. These laws are working well in South Dakota today. I'm not aware of an instance where an employee was not accommodated by hospital policy for a conscientious objection or had a filing with the South Dakota Human Rights Commission or EEOC, Equal Employment Opportunity Commission, for a conscientious objection. I want to pause here that if there is an instance that I'm not aware of, it's important to note that there is a process in place by which a provider does have the ability to lift up their concerns. The definition section of conscience in this bill is broad, including ethical, philosophical, moral, or religious beliefs or principles. The bill also applies broadly to any healthcare service from scheduling to examination, diagnosis to treatment, and housekeeping to food service. The biggest issue with these two broad definitions is that this bill will protect good conscience the same as it protects an evil or poorly formed conscience. Let's talk about a few scenarios this bill will protect. A hospital housekeeping employee who holds sincere ethical beliefs that synthetic cleaning agents hurt the environment and will only use natural products like vinegar to clean hospital rooms, putting patients and staff at risk. A nurse aide who believes in pacifism and refuses to assist in de-escalating a patient in a mental health crisis. This would create an unsafe situation for the distressed patient as well as other patients and staff. A dietary aide in the nursing facility who believes the use of any animal-based products is cruel and immoral and refuses to prepare and serve meals containing animal-based products to residents. The point of all of that is healthcare facilities that employ individuals have an obligation to provide appropriate care to these patients, regardless of the conscientious objection of each of these individuals. But the bill does not provide recourse to the facilities acting as employers to accommodate the individuals in these scenarios through transfer or reassignment to an equivalent job, since the bill defines transfer and reassignment as prohibited discrimination. This means that these individuals could create unsafe situations or provide poor patient care without any consequence. The only option available to the facility is to employ an additional employee to fulfill the facility's obligations to appropriate care. I cannot tell you how, in a working environment today where we can't hire enough staff, can you imagine in the Gettysburg Hospital if they hired a dietary aide and that person cannot be reassigned, according to this bill, if you read the bill, they cannot be reassigned, but they cannot do their job because they don't want to. Conspicuously absent from this bill is the word patient. The bill doesn't mention the patient one time. It puts healthcare providers, facilities, and payers ahead of what we all agree should be the focus of healthcare, the patient. Under this legislation, a payer wouldn't have to notify a patient of services not covered by conscience. For example, a medically necessary blood transfusion could be denied coverage by an employer with religious objections to blood transfusion, leaving the patient potentially liable for hundreds or thousands or tens of thousands of dollars in non-reimbursable care. This bill could protect providers who actively discriminate against patients based on their race or religion. Patients could find themselves left in the dark about their own health status or condition, and under this bill, a provider does not have to notify a patient about a diagnosis or refer that patient to an alternative provider. There isn't any recourse for the patient. In closing, this bill is a dangerous expansion of protections that will shield persons acting in bad conscience, as well as good conscience, result in a myriad of harmful, unintended consequences that are wholly unnecessary. I ask you to vote no on House Bill 1242.